DMOC, Luxe Beauty Line Guide for Botox and Dermal Fillers. Botox. Introduction. Botox is a brand name of a toxin produced by the bacterium Clostridium botulinum. There are other brand names for botulinum, such as Xeomin. In large amounts, this toxin can cause botulism, which you probably associate with food poisoning. Despite the fact that one of the most serious complications of botulism is paralysis, scientists have discovered a way to use it to human advantage. Small, diluted amounts can be directly injected into specific muscles, causing controlled weakening of the muscles. The FDA approved such usage in the late 1980s upon the discovery that Botox could stop ailments like blepharospasm, uncontrolled blinking, and strabismus, lazy eye. Doctors have been using Botox for years to successfully treat wrinkles and facial creases. In April 2002, Botox gained FDA approval for treatment of moderate to severe frown lines between the eyebrows, called glabellar lines. However, Botox is often. How does Botox work? Botox blocks signals from the nerves to the muscles. The injected muscle can no longer contract, which causes the wrinkles to relax and soften. It is most often used on forehead lines, crow's feet, lines around the eye, and frown lines. Wrinkles caused by sun damage and gravity will not respond to Botox. How is a Botox procedure performed? Getting Botox takes only a few minutes and no anesthesia is required. Botox is injected with a fine needle into specific muscles with only minor discomfort. It generally takes 3 to 7 days to take full effect, and it is best to avoid alcohol at least 1 week prior to treatment. Aspirin and anti-inflammatory medications should be stopped 2 weeks before treatment as well in order to reduce bruising. How long does a Botox injection last? The effects from Botox will last 4 to 6 months. As muscle action gradually returns, the lines and wrinkles begin to reappear and wrinkles need to be retreated. The lines and wrinkles often appear less severe with time because the muscles are being trained to relax. What are the side effects of Botox? Temporary bruising is the most common side effect of Botox. Headaches, which resolve in 24 to 48 hours, can occur, but this is rare. A small percentage of patients may develop eyelid drooping. This usually resolves in 3 weeks. This usually happens when the Botox moves around, so you shouldn't rub the treated area for 12 hours after injection or lay down for 3 to 4 hours. Who should not receive Botox? Patients who are pregnant, breastfeeding, or have a neurological disease should not use Botox. Since Botox doesn't work for all wrinkles, you can visit us in Luxe Beauty Clinic in Cairo or Hurghada to give the best advice about your case. Why with Luxe Beauty Line? We are licensed surgeons with a long experience in dermatosurgery controlled by the legal medical practice in Egypt. We provide our clients with a good quality material we trust in that our clients can choose clearly, can check it pre-injection. We offer our service in our clinics or at your place to make it more easy and more flexible for our clients. Provide free recorrection after 1 week of injection. Uses of Botox on face. Glabellar lines. Treatment of glabellar lines is the most common cosmetic use of botulinum toxin. The glabella is a patch of skin between the eyebrows and above the nose. Crow's feet. Crow's feet, aka periorbital lines or lateral canthal lines, are wrinkles that branch from the outer corners of the eyes while smiling. Of note, crow's feet that are static, thus occurring in both the presence and absence of smiling. Crow's feet are the second most frequent types of wrinkles treated with Botox cosmetic, which works beautifully with the dynamic wrinkles in this area. Forehead wrinkles. The relatively large facial muscle that overlays the forehead is called the frontalis muscle. When the frontalis muscle contracts, the brow raises and forehead lines appear. Bunny lines. Bunny lines occur on the bridge of the nose. They can become more prominent after botulinum toxin treatment for glabellar lines or crow's feet. Thus, people who have Botox treatment for glabellar lines or crow's feet often return for treatment of bunny lines, too. Lipstick lines. Perioral or lipstick lines are vertical wrinkles above the upper lip. The formation of lipstick lines is likely multifactorial, and photoaging, hereditary factors, puckering and smoking all contribute. Usually lip lines to get good results should be augmented by fillers. Marionette line and sad mouth corners. Marionette lines are vertical wrinkles that originate at the corners of the mouth and branch downwards towards the chin. These lines resemble the borders of the jaw segment of a marionette. Marionette lines are usually treated with both botulinum toxin and dermal fillers. Chin dimpling. Chin dimpling gives the chin an orange peel peau d'orange appearance. As with the treatment of marionette lines, smoothing chin dimples often requires both botulinum toxin and dermal fillers. 2. Dermal fillers. What are dermal fillers? Dermal fillers are small injections of gel, typically made up of hyaluronic acid, that fill in wrinkles and add volume to soft tissue. You can have dermal fillers in different parts of your face, around the eye, cheeks, mouth and jawline, as well as lip fillers administered directly into the lip tissue. How do they work? Fillers basically restore lost volume to your face and plump areas, so that deep-set lines are smooth. Why is this needed? Well, as we get older our bodies stop producing collagen and elastin, both of which contribute to the youthful look. Experts argue over when we start losing collagen, but the generally agreed age is 25. Which is pretty young, right? Your collagen and elastin levels then decline at a rate of about 2% per year, and your body will have stopped producing it altogether by your late 20s. Fillers have been used for decades to restore lost volume or add lift. How long do dermal fillers last? It depends how your body reacts and which hyaluronic acid is used, and if the client is smoker or not and the amount of alcohol he drinks, but most dermal fillers will last between 6 to 18 months. Do dermal fillers have side effects? It's easy for clients to confuse side effects to reactions, so it's extremely important to understand what side effects can be expected. Temporary side effects, those that are completely normal after facial injections, can include swelling, redness and tenderness. It's completely normal to experience a little bit of discomfort, redness and bruising after the procedure. Reactions generally occur immediately after the needle injection and can include redness, swelling, pain, itching, bruising and tenderness at the injection location. These reactions are generally mild to moderate and usually disappear shortly after injection and are usually resolved a few days after the injection into the skin. Do dermal fillers hurt? There may be a slight discomfort whilst the filler is being injected into the face. But we minimize this by applying an anesthetic cream before treatment. To provide further relief and alleviate as much pain as possible, our fillers contain a pre-mixed local anesthetic. Are there different types of dermal fillers? As we said above, the most common type of facial filler is hyaluronic acid, the natural substance found in many areas of the body including eyeballs, joints and skin, that can hold 1000x its weight in water. Hyaluronic facial fillers helps to maintain shape, even out depressions in the skin and provide hydration. Polycaprolactin, PCL, or Elens is another popular filler that acts as a collagen stimulator, Dr. Long explains. When injected in strategic places in the face, it triggers the body's natural response to produce collagen, which provides you with a much longer lasting result. Is there a difference between Botox and dermal filler? Yes, there is 100% a difference between Botox and fillers. Botox stops the small muscles in your face from making the movements that cause wrinkles, whilst dermal fillers plump from below the wrinkle to smooth them out and promote the youthful look. How much do dermal fillers cost? So how much do dermal fillers set you back? Well, that depends entirely on how much you're going to have done, which fillers you opt for and who you pay to administer them. Obviously every clinic differs, but the general starting price for facial fillers is from €180 per syringe, in Dr. Mahmood said clinic. Where should you go to get dermal fillers? Luxmedics Beauty Line Clinics in Cairo or Hurghada. We provide you with best and the easiest to book service. You can visit us in the clinic with previously booked appointment, or we can provide the service at your place under complete sterilization. Just text us on WhatsApp number +2012212647774, or text us on our page Messenger Dr. Mahmood Online Clinic. For tourists, you can arrange with us on any day in your trip you with C-codary protection of UV block. However, there are things you can do to maximize those results and make them last for as long as possible. Protect your skin. Fillers are just one more reason to protect your skin from the sun's UV rays. Eat a healthy diet. Be careful about exercise. Stay calm. Take care of your skin. Schedule repeat treatments. Uses of dermal fillers. Nasolabial holds. We usually give our advice for our clients to try cheek fillers and under-eye fillers in the mild cases of nasolabial fold crease cause. Sometimes flat cheeks and under-eyes creases make nasolabial fold more prominent. Lip fillers. How do lip enhancements work? In order to get the perfect lips, we assess the current shape of your lips and use dermal filler injections to enhance the shape to your desire. Dermal filler injections are composed of hyaluronic acid, which is a type of non-permanent filler that is naturally broken down over a period of months. It is completely safe, reversible, and can achieve beautiful results. What to expect? As always, our practitioner will have a detailed conversation with you in regards to what you are hoping to achieve. We will then take a medical history from you and then devise a treatment plan specifically tailored to you. Finally, once we have discussed the procedure and answered any questions you may have, we will then ask you to sign a consent form. A picture will be taken for comparison for when you have had the lip enhancement treatment. Chin augmentation. The chin has always been one of the more striking facial features. In not men and women, augmented chin always can be enough to give him or her smart, attractive look. Dr. Mahmood says, "No much people know how augmentation of their chin can change their look for younger and more attractive look. You will experience totally new look like movie stars just after the injection." Unfortunately, fillers in chin stay for longer time more than any other place in face. Marionette line. Marionette lines take their name from marionette puppets, as the lines run from the corners of the mouth down to the chin and resemble the mouth of a puppet. These lines are caused when the skin loses elasticity due to aging and the damaging effects of sun exposure. Weight loss can also cause marionette lines, when fat is lost on the face and causes crease lines from the mouth to the nose. Dermal fillers are an effective treatment for marionette lines. They can thicken the skin and reduce the marionette fold lines. Fillers not only help to improve the appearance of these deep wrinkles, but they restore and moisturize skin in this area. They work by providing extra fullness to the area where wrinkles are apparent. Cheek augmentation, facial volume loss. Facial volume loss. As we get older, one of the most noticeable facial changes is the loss of volume in the cheek area as the malar fat pads move down under the force of gravity. This is most obvious in patients that are slender or have a normal age-appropriate weight. The cheekbones become less pronounced and the skin becomes saggier. In some patients, this can create a gaunt, or aged look. Injectable fillers offer a quick and effective method of a subtle cheek enhancement. This additional volume into the cheeks make the face appear more youthful and uplifted. The effect is not designed to be dramatic, nor should it be, but a subtle improvement that looks natural. This is a quick solution with immediate effects without swelling and potential downtime and bruising from surgery. While the effect of injectable cheek augmentation is only temporary, how long it lasts will be influenced by what type of injectable filler is used. We use an advanced dermal filler as we find it allows the smoothest and most natural look and lasts from 9 to 12 months. Injectable cheek augmentation can be enhanced by the simultaneous use of specialist injections in the crow's feet and cheek areas. This combination of treatments helps enhance the middle part of the face so that it looks natural and relaxed, and it only takes 30 minutes. At Dr. Mahmood Beauty Clinic, we are completely focused on you as an individual and will always strive to give you a natural-looking end result that exceeds your expectations and makes you feel confident about your appearance. Tear trough PERIORBITAL rejuvenation. We can restore volume loss and sculpture the face and cheeks as well as hydrating the skin. As you age, the hollow between the eye area and the upper cheek can deepen, creating a tired look. The tear trough can be softened with Restylane or Restylane Polane. It is a subtle treatment but one that makes all the difference. The treatment will help diminish those troublesome bags or hollows that can appear under the eyes over time. Non-invasive alternative treatment to surgery that can help diminish the appearance of dark hollows or bags under the eyes. The procedure is safe and has been used on patients for several years with great success. The results can be seen instantly and can last from 6 to 12 months. The treatment is associated with mild discomfort which can be minimized with the local anesthetic. This treatment has known to have a short downtown. Rhinoplasty. Rhinoplasty is the reshaping of the nose for cosmetic or reconstructive purposes. It is one of the most popular and desired cosmetic procedures, but, understandably, many patients are concerned about undergoing surgery due to the potential complications and the risk of unfavorable results. Non-surgical rhinoplasty is sometimes referred to as the 15-minute nose job. It is a safe, non-invasive alternative to surgery for people who wish to change the shape of their noses. The procedure uses dermal fillers, injected in small amounts in precise locations, to change the shape and contour of your nose. At the PAROME clinic, our dermal filler treatments are very much tailored to the individual in order to leave your nose looking natural, attractive, and in harmony with the rest of your face. We will always strive to give you a naturally fabulous end result that exceeds your expectations and makes you feel confident about your appearance. Indications for treatment. Flat or low nose bridge. Some ethnicities, e.g. from Northeast Asia and China, naturally have a lower nose bridge. This can easily be augmented with dermal filler. Crooked, hooked noses with dorsal humps. A crooked nose can be congenital, i.e. present from birth, or can occur through injury. Hooked noses or those with a hump can be smoothed out with a non-surgical rhinoplasty treatment. Ski slope. Noses with an aesthetically pleasing bridge and tip can be deficient in between, resulting in the ski slope nose. This condition is improved via dermal filler to straighten the midsection of the nose. Rhinoplasty revision. Quite often following a surgical rhinoplasty procedure, the nose has minor bumps or asymmetries that can be easily improved with a non-surgical nose job. The 8-point lift. The 8-point lift is a specialized volumizing and lifting facial treatment, also referred to as a non-surgical facelift or liquid facelift. The treatment uses dermal fillers to enhance and discreetly lift the face for a total rejuvenating effect. It is also known as the fluid facelift and the liquid lift. The 8-point lift targets key areas of the mid-face to lift contour and revitalize the whole mid and lower face. Submental crease. LUXMEDICS Facial Analysis Program. As a facial cosmetics surgeon, Dr. Mahmood said has an in-depth knowledge of facial anatomy and its associated hard and soft tissues. It is imperative for the surgeon to be able to appreciate and define elements of facial aesthetics as well as the stigmata of an aging face. It is critical to be able to objectively analyze facial features preparatively in order to correctly identify areas of concern and to arrive at an appropriate treatment plan for each patient. Dr. Mahmood developed a special program for Luxmedics Beauty Line Clinic to provide the best solution for any facial defect. We process the given client facial data in our clinic or from requested pictures online. Facial features analysis enable us to discover our client's defects and beauty points. To give our client beautiful natural look and prevent overcorrection of defects. Types of fillers do we use? Restylane. Stylage. Juvederm. We choose for you the best for each treated area in your face and according to your budget. Jawline fillers. Over the last decade, our collective desire for increased facial definition was firmly on the up. Playing out on social media, and seen on the most followed famous faces, it all started with prominent cheekbones, then voluptuous lips, and now the defined chin and jawline. Why do we lose volume in the jaw and chin area, and what does this look like? Genetically, some people have a small or weak jawbone or chin, whereas others lose volume through the aging process. As we age, we lose bone in our skull, our cheeks deflate, which mean that facial fat drops downwards with gravity. The bone loss that happens in our jaw means that the lower face no longer has a strong framework, and our skin and fat can hang loosely with no tension in them. This can mean the face looks saggy and jowly, that the chin can look more square, and that the neck looks looser and like we have developed a double chin. Do you mostly perform jaw filler on more mature clients? I perform this treatment on people of all ages. Chin and jawline enhancement is a popular treatment in younger patients who have a genetically weaker jaw or chin, in whom major orthognathic surgery to advance the jawbone would be the only other option. It's also popular in more mature patients who have lost the strength of their jawline through aging. In the more mature set of patients, we often need to address the cheeks before we address the jawline, to ensure we give the soft tissues of the face enough support. Offers. You can follow us on Facebook page Dr. Mahmood Online Clinic, Instagram, or on our WhatsApp +201 221264774. Or email us on dr.m@luxmedics.com to get our new offers and discounts for our clients and price list for tourists and residents.